So for my older adult case study, I had Ursula, and she's a 34-year-old female who's married, and she has the occupation of a hairdresser. She and her husband have 4 children together, and she works 6 days a week as a hairdresser, and her family goes to church every Sunday, and that's really important to her. But about 6 months ago, Ursula noticed by lunchtime when she was working, there was a tingling in her right hand, but by the time lunch was over, the tingling would go away. But then a few weeks after that, she started noticing that her right hand would just feel like it fell asleep. And this would be towards the evening when she got home from work. And she started noticing that she was dropping silverware a few times, trying to make dinner for her family. But by the time she went to bed at night, her right arm would be feeling tired and painful. So at that time, Ursula reported that all of these symptoms would be gone by the time she woke up in the morning at first, but it quickly progressed and her right arm was just hurting all of the time. So, and then during that time when her right arm was hurting all of the time, she stated that she almost dropped a hairdryer on a few of her clients at work, and that's what made her see her primary care physician. And her primary care physician prescribed her a wrist brace that you can get at, a local pharmacy that stabilizes the wrist, so to see if that would help her pain and help her be able to work, because work is very important to her. But Ursula reported that the pain never completely went away, so her primary care physician referred her to a hand specialist who tried anti-inflammatory medication, corticosteroid injections, made her like a custom orthotic or orthoses to wear on her right hand, and also prescribed her rest for 1 week. So Ursula stated that everything the hand specialist tried helped, but when she went back to work, her symptoms came back with the same intensity. So she also stated that she was unable to wear the custom orthosis at work because she could not use the scissors or hold the hairdryer to dry people's hair, so she hadn't been wearing it. So that's probably why her symptoms kind of returned as well. So at Ursula's follow-up appointment with the hand specialist, they diagnosed her with carpal tunnel syndrome in her right hand and scheduled surgery to release the nerve compression, which is the median nerve for carpal tunnel. But in the meantime, Ursula started having symptoms of carpal tunnel in her left hand. So Ursula's come to occupational therapy 2 weeks post carpal tunnel release surgery on her right hand, and for conservative treatment on her left hand for the carpal tunnel syndrome. So as the evaluating OT, I would use several different assessments to gain a holistic perspective of Ursula's current functional and sensory capacity, but the one assessment I'm going to focus on today is the Simmy's Weinstein monofilament test. The monofilament test is particularly useful for the carpal tunnel patient population because it is a brief, standardized, quantitative measure of tactile thresholds specific to the upper extremity. And so therapists can use the monofilament assessment to grade a nerve injury or to track recovery. And so since Ursula said that she was having some trouble like gripping objects and having a lot of pain, I think that this assessment will give us a lot of information and be able to track her recovery for both hands. So each monofilament in the kit represents a different force grade, and they each have a monofilament that gets thicker as you go up to grade different interpretations. So for instance, the green monofilament is the shortest and lightest. I'm not even sure if you can see that, but it's short and light compared to this red filament that barely even moves when you touch it. So the green is going to have the interpretation of normal. Blue is going to have diminished light touch. So if you're doing this test on different areas and they can only feel the blue, then they're going to have diminished light touch in that area. If they get down into the purple, they're going to have diminished protective sensation, which is pretty dangerous for washing dishes or doing anything with any type of heat, as they probably can't feel that. And then when you get down into the red, that's loss of protective sensation and then deep pressure sensation. So that's pretty dangerous when you're getting into those levels, and this assessment can just track those as therapy progresses, or if they have a new nerve injury, you can use these as well. So whenever you're administering the monofilament test, it is important to have the client in a quiet area with their hands stabilized on a table if possible. Some therapists might use TheraPutty to keep the client's hands stabilized, but just make sure that you're checking skin integrity before you were to use TheraPutty with your client. So the client should then be instructed to close their eyes and say yes or touch when they feel the pressure of the monofilament. And so the therapist should work from distal to proximal on each hand. So you would kind of start up here and work your way down. And you can even go into the wrist and forearm area with this test as well. So, and for like the green, blue, and purple monofilaments, you want to touch them 3 times in the same area to keep it standardized. But once you get up into the red filaments, especially the thickest one, you just want to touch them 1 time. And if they can't feel that, then they are not responsive to the test. And so you would want to make note of that. But also just another administration tip is whenever you're administering this, you want to make sure that you see a nice C bend. So that's when you know that you're have the correct force. And then also with the monofilament test, you can buy these paper records where it has kind of like the interpretation at the top and pictures of hands at the bottom. I just traced this for the purposes of this video because it does cost money, but in your clinic you can kind of buy those with the monofilament kits. So here's kind of what I made as documentation for this assessment. And so it has the volar and dorsal aspects of both hands and then the interpretation levels up at the top. So then you can make notes kind of across there and then scan this into your client's chart when you're finished. Okay, so now we're going to try this on Ursula. Hi Ursula, welcome to Occupational Therapy. My name is Chloe and I'm going to be your therapist today. How are you feeling?
I'm doing pretty good.
Okay, all right. Well, I know that it's been about 2 weeks since you had the carpal tunnel surgery on your right hand, and your doctor was discussing with me that he would like to do conservative treatment for your left hand so that you don't have to have another surgery for carpal tunnel. So today, to kind of track your progress through therapy, we're going to do this test, and it's called the monofilament test. And so basically what I'm going to do is kind of test your sensation or how you're feeling things on both of your hands, and then we're going to track that through therapy to make sure you're getting better. Is that okay?
That sounds great.
All right. So I'm going to start with your right hand, if you would just lay it on the table for me. And these are the monofilaments. And so I'm basically going to have you close your eyes, and I'm going to kind of tap you with the monofilament. So it doesn't hurt or anything. But when you feel the monofilament, I want you to say yes. And if you don't feel it, it's okay. It's not a test. You can just stay silent, okay? So we're going to go ahead and get started. So just say yes when you feel it, or just nothing if you don't, okay?
Yes. 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 Yes.
Okay. Okay. We're done with that hand. You can open your eyes and kind of take a little break.
Mm-hmm.
I'm just going to kind of finish drawing up this for your chart, and then we'll move on to the next, to your left hand, okay?
Mm-hmm.
Okay, so let's go ahead and do your left hand now.
Okay.
And yeah, so we'll go ahead and get started. If you could just go ahead and lay that out there for me.
Mhm.
Awesome, and just try to relax as much as you can. I'll move these for us. And so, same thing, I'm going to have you close your eyes, and we're just going to do the same thing on this hand, okay? So whenever you feel it, just say yes.
Okay. Yes. 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 Yes.
Okay, we're done with that left hand. So yeah, you can just open your eyes and take a little break, and I'm just gonna kind of finish drawing up
Mm-hmm.
what we found. Okay, Ursula, so I have kind of a little bit of a drawing here to help you understand your results for the sensation test. So, green is going to be normal sensation, which you kind of can see on your pinky finger and your ring finger on both sides, left and right. But the blue and purple that you see, this is going to fall with your median nerve distribution. And so basically, that's the nerve that is involved in carpal tunnel syndrome. So that's pretty normal to see that type of test with what you have. So that's okay. And so basically, with the blue, that's going to be the level for diminished light touch, which you say that you've had because you've been dropping some silverware and different things.
Mm-hmm.
And then the purple is going to be diminished protective sensation on that right hand. So from this test, I just kind of want to caution you with your right hand. Whenever you're washing dishes, washing people's hair at work, or bathing yourself or doing anything with heat, I just want you to be very careful. Make sure you're checking your skin on your hand, that you're not burning yourself or anything like that, because that can get pretty dangerous down with that level. So hopefully we will get to start therapy, and then we'll see where you go from there, okay?
That sounds good.
Thanks for coming in.
Thank you.